Dive into the forefront of cancer care with Gastrointestinal Oncology, a critical multidisciplinary team approach. Crafted by top international experts, this second edition is more than just a book. It's your gateway to the latest evidence-based strategies for tackling esophageal, gastric, intestinal, and other GI tumors. Discover how collaboration among diverse healthcare professionals revolutionises cancer treatment, and unlock the power of groundbreaking research, including the cutting-edge use of AI. Whether you're a seasoned clinician, a trainee, or a medical practitioner, this indispensable resource sets the gold standard for effective patient management and clinical decision-making. Are you ready to lead the charge in gastrointestinal oncology? Gastrointestinal Oncology, a critical multidisciplinary team approach. Written and edited by leading international experts in the field, Gastrointestinal Oncology, a critical multidisciplinary team approach is an indispensable reference for clinicians, medical practitioners, and trainees involved in the investigation, diagnosis, and treatment of esophageal, gastric, intestinal, colonic, hepatobiliary, pancreatic, and other gastrointestinal tumors. Drawing on the most current evidence-based knowledge, this comprehensive resource reflects the current care of GI cancer patients, enabling effective clinical decision-making and patient management. Setting the standard in clinical practice, Gastrointestinal Oncology remains the only truly multidisciplinary reference designed for the diverse team of clinicians responsible for different stages of cancer treatment. Specially structured clinical chapters, each representing a different role in the multidisciplinary team, MDT, allow clear presentation and quick reference of the contents. This is supported by a wealth of high-quality color photographs, line drawings, and diagrams. Now in its second edition, this authoritative reference is fully updated to reflect groundbreaking research in multiple medical fields, including the explorative use of AI. New sections on palliative care and nutrition are accompanied by new subsections on molecular characterization, new targeted small molecules, receptor options, and immunological therapies for each cancer. This edition places renewed emphasis on the most ubiquitous conditions, such as colon cancer, liver cancer, and gastroesophageal cancer. Covering the oncology of the entire gastrointestinal tract, Gastrointestinal Oncology, a critical multidisciplinary team approach is a must-have reference for the entire MDT, including gastroenterologists, hepatologists, GI surgeons, medical oncologists, radiation therapists, interventional radiologists, pathologists, nutritionists, palliative care professionals, and specialist nurses, as well as clinical scientists. Here are some keywords and their meanings based on this content. 1. Gastrointestinal Oncology. Gastrointestinal oncology is the study and treatment of cancers affecting the digestive system, including the esophagus, stomach, intestines, colon, liver, pancreas, and other related organs. 2. Multidisciplinary team. A multidisciplinary team is a group of healthcare professionals from different specialties working together to provide comprehensive care for patients. 3. Esophageal cancer. Esophageal cancer is a cancer that develops in the esophagus, the tube connecting the throat to the stomach. 4. Gastric cancer. Gastric cancer is a cancer that forms in the lining of the stomach. 5. Intestinal cancer. Intestinal cancer is a cancer occurring in the small intestine or large intestine, colon. 6. Hepatobiliary cancer. Hepatobiliary cancer is a cancer affecting the liver, bile ducts, or gallbladder. 7. Pancreatic cancer. Pancreatic cancer is a cancer originating in the pancreas, an organ located behind the stomach that produces digestive enzymes and hormones. 8. Evidence-based knowledge. Evidence-based knowledge is information derived from systematic research studies and clinical trials to guide medical decision-making. 9. Clinical decision-making. Clinical decision-making is the process of choosing the most appropriate treatment or management plan for individual patients based on clinical judgment and available evidence. 10. Patient management. Patient management is the coordinated provision of medical care and support services to patients throughout their illness. 11. Palliative care. Palliative care is specialized medical care focused on providing relief from the symptoms and stress of a serious illness, often given alongside curative treatment. 12. Nutrition. Nutrition is the study of how food and nutrients affect health, particularly in cancer patients, for maintaining strength and managing side effects of treatment. 13. Molecular characterization. Molecular characterization is the analysis of the genetic and molecular features of tumors to guide treatment decisions, such as identifying specific mutations or biomarkers. 14. Targeted small molecules. Targeted small molecules are drugs designed to interfere with specific molecules involved in cancer growth and progression, often with fewer side effects than traditional chemotherapy. 15. Receptor options. Receptor options are various cellular receptors targeted by drugs for therapeutic purposes, such as hormone receptors or growth factor receptors. 16. Immunological therapies. Immunological therapies are treatments that harness the body's immune system to fight cancer, including immune checkpoint inhibitors and CAR T-cell therapy. 17. Colon cancer. Colon cancer is cancer that begins in the colon or rectum, often referred to as colorectal cancer. 18. Liver cancer. Liver cancer is cancer that originates in the liver cells and is often associated with chronic liver diseases such as cirrhosis or hepatitis. 19. Gastroesophageal cancer. Gastroesophageal cancer is cancer affecting the stomach and esophagus, including cancers of the gastroesophageal junction. 20. Clinical scientists. Clinical scientists are professionals involved in conducting research and translating scientific discoveries into clinical applications to improve patient care. Here are some questions and suggested answers based on this content. 1. Who is the target audience of the book, Gastrointestinal Oncology, a critical multidisciplinary team approach? Suggested answer. The target audience includes clinicians, medical practitioners, and trainees involved in the investigation, diagnosis, and treatment of gastrointestinal tumors. 2. What is the main focus of the book? Suggested answer. The book focuses on providing comprehensive information on the investigation, diagnosis, and treatment of esophageal, gastric, intestinal, colonic, hepatobiliary, pancreatic, and other gastrointestinal tumors. 3. Who are the authors and editors of the book? Suggested answer. The book is written and edited by leading international experts in the field of gastrointestinal oncology. 4. How does the book assist in clinical decision-making? Suggested answer. It draws on the most current evidence-based knowledge to reflect the current care of GI cancer patients, enabling effective clinical decision-making. 5. Why is gastrointestinal oncology described as a multidisciplinary field? Suggested answer. Gastrointestinal oncology requires the collaboration of various healthcare professionals from different specialties to provide comprehensive care for patients. 6. What is the significance of the structured clinical chapters in the book? Suggested answer. The structured clinical chapters represent different roles in the multidisciplinary team, allowing clear presentation and quick reference of the contents. 7. What types of visual aids support the content in the book? Suggested answer. The content is supported by a wealth of high-quality color photographs, line drawings, and diagrams. 8. What updates are included in the second edition of the book? Suggested answer. The second edition is fully updated to reflect groundbreaking research, including new sections on palliative care and nutrition, along with subsections on molecular characterization, targeted small molecules, receptor options, and immunological therapies for each cancer. 9. Which medical fields have contributed to the updates in the second edition? Suggested answer. The updates in the second edition reflect groundbreaking research in multiple medical fields, including the explorative use of AI-10. What are some of the new sections added to the second edition? Suggested answer. New sections on palliative care and nutrition are added, along with subsections on molecular characterization, targeted small molecules, receptor options, and immunological therapies for each cancer. 11. Which conditions receive renewed emphasis in the second edition? Suggested answer. The second edition places renewed emphasis on the most ubiquitous conditions, such as colon cancer, liver cancer, and gastroesophageal cancer. 12. Who is recommended to have this book as a reference? Suggested answer. The book is recommended for the entire multidisciplinary team involved in gastrointestinal oncology, including gastroenterologists, hepatologists, GI surgeons, medical oncologists, radiation therapists, interventional radiologists, pathologists, nutritionists, palliative care professionals, specialist nurses, and clinical scientists. 13. Why is the book described as an indispensable reference? Suggested answer. It is described as indispensable because it provides essential information for clinicians and practitioners involved in the investigation, diagnosis, and treatment of gastrointestinal tumors. 14. How does the book support effective patient management? Suggested answer: by providing comprehensive information on current evidence-based practices, the book supports effective patient management throughout the course of treatment. 15. What role does evidence-based knowledge play in the book? Suggested answer: the book draws on the most current evidence-based knowledge to ensure that clinicians have access to the best practices in the care of GI cancer patients. 16. What distinguishes this book from others in the field? Suggested answer: this book is distinguished by its multidisciplinary approach, clear presentation of content, and emphasis on current evidence-based practices. 17. How does the book contribute to setting standards in clinical practice? Suggested answer: the book contributes to setting standards by providing comprehensive information and guidance for the diverse team of clinicians responsible for different stages of cancer treatment. 18. What are some key features of the second edition? Suggested answer: some key features include updated content reflecting groundbreaking research, new sections on palliative care and nutrition, and renewed emphasis on prevalent conditions such as colon cancer, liver cancer, and gastroesophageal cancer. 19. How does the book address the entire gastrointestinal tract? Suggested answer: the book covers oncology related to the entire gastrointestinal tract, including the esophagus, stomach, intestines, colon, liver, pancreas, and other related organs. 20. Why is collaboration among various healthcare professionals emphasized in gastrointestinal oncology? Suggested answer: collaboration among various healthcare professionals is emphasized to provide comprehensive care for patients, considering the complexities of gastrointestinal cancers and the diverse treatments involved. This material primarily helps to learn English vocabulary, English grammar, and English sentence structure. Thank you for watching. Thank you for thinking about subscribing to see various exciting videos.